Hi students, I am Dr. Badrinath. In this video, we will see the histamine. Histamine, I have already told it is a part of atachids. So in the atachids chapter, we will see what is a histamine. Once I step in, history repeats. The same powerful dialogue by my favorite actor, that is Balakrishna. Once I step in, histamine breaks. Histamine breaks. See here, how history, histamine. Histamine is a villain. Okay. Once step in, histamine has to break. Main biggest villain in the body is the histamine. Actually, it is atachiid. It is a local hormone only. Okay. Why it becomes a villain? That we will see now. Okay. See here, the histamine main problem is, see here the cockroaches or insects has came here to this fellow, he is fearing to this. Because once there is attack of any insect or cockroach or like that, anything happen, immediately you will get a redness on the skin. Allergy, allergy. Okay, redness, rashes on the skin. All these rashes main cause is the histamine. If there is no histamine, there is no allergy. Okay, that keep in your mind. Actually, it is produced for our body good only, but we cannot tolerate the allergy, histamine. So that's why it is necessary to take a medication against the histamine. That's why I am calling as a histamine is the villain. Okay. This is your third unit, attachoids and related drugs. Introduction already over. Introduction to attachoids and classification is over. Histamine is one of the attachoid. Keep in your mind. That is very, very important point. Don't forget, all these chapter names are attachoids only. 5-HT, serotonin, prostaglandins, thromboxanes, leukotrienes. Okay. Now we will see like that. You can see up to the E, G, F, G. Now, in this video, we will see the red line, highlighted line, histamine and their antagonists. Another video I will make on the serotonin, 5-HT, and their antagonists. That is, we will see in the next video. In this video, we will focus only on the histamine. Here you can see the classification of atachids. It was there in my last video also. Here you can see the histamine. It is a amine derivative. Okay, name itself indicates. Okay, and how to remember this ALPO, amine attachoid, lipid derivative attachoid, peptide attachoid, other attachoids. All are separate chapters for you. Okay, in this chapter we will focus only on the histamine, and ALPO is a code. ALPO. Like that you can remember. Yeah, histamine. Histamine comes from the histidine. Histidine is a father. Histidine is a mother of histamine. Histamine comes from the histidine. Decarboxylase. Decarboxylase. We are removing the carboxyl group. That's why we are calling as a decarboxyl group. This is more than enough in the exam to write. If you want, you can see this also, you can keep in your mind. If you are interested in chemistry, you can see carboxyl group CO2 we are removing. See here C, O, this O also. CO2 we removed. So you will get a histamine, right? In the exams they will ask, histamine comes from dash, histidine. In competitive exam also they will ask. Or histidine metabolized to histamine, first of all. Okay. Or what is the pro molecule of histamine? Histidine is a pro, means previous. Like that, you have to practice. Degeneration of the histamine. So far we know histamine comes from histidine. Now this histamine, how it is breakdown? What is the metabolic fate? What will be the future of histamine? The future of histamine is here HNMT, N-methyl histamine, imidazole aldehyde, ALD, imidazole acid. These are the byproducts. Products are metabolic products of the histamine that you have to practice. MAO, N-methyl amidazole, acetic acid. You have to take a pen and practice this. This is important. Okay, right. And histamine secretes from the four types of cells. Keep in your mind. 1, 2, 3, 4. Here you can see the symbol of a 4. 4 is a fire. There should be a fire in your thoughts. Major histamine derivative cell. You can see here, major. Minor histamine producing cell. Majorly four types are there. Minor is not much important, but here I have shown, however, these four cells names you have to practice. Mast cell, mast, massive, mastication is also there. Mass, movie is also there. Mast cell produces the histamine massively. Massive production of the cell. Can keep. Basophil, boss, boss. That is also movie is there, boss. ECL, easily it synthesizes the histamine, releases the histamine. Histaminergic neuron. There is a neuron structure. See, mast cell, this IgE, immunoglobulin E, is very, very important bit. IgE, immunoglobulin, it is an antibody produced in our body. It produces against the antigens. Whenever antigens comes, our body produces immunoglobulin E. That immunoglobulin E, it stimulates the mast cells. Mast cell releases the histamine. That leads to the allergy. So that's why we will get a allergy. These are the IgE cross-linking, complement, allergy-inducing drugs. Which of the cell is which of the following cell is involved in the production of the allergy? Mast cell. Which cell secretes the histamine? Mast cell. Massively it produces. IgE, next IgE cross-linking, complement, allergy indicating drugs, basophil. Next is basophil. Third one, no weight is related to allergy. Keep in your somatostatin, gastrin. Next is activation of N-methyl D aspartate, U opioid, dopamine, D2, serotonin receptors. All these side is not much important. IgE is very important. That keep in your mind. These names are important. It produces the histamine. See here how histamine is released. Okay. And minor histamine cells, T cells, dendritic cells, that is nerve cells, dendritic, macrophages, neutrophils, epithelial cells. Okay, minorly, small, very small. Four keep in your mind, four cells. Now, four histamine receptors are there. Four cells releases, acts on four types of receptors. All are histamine receptors only. H1, H2, H3, H4. See here H1. See histamine once it is released here, this histamine receptors is there, no? H1, H2, H3, H4. All are G protein coupled receptors. Very important bit in the exam. G protein coupled receptor. All H1, 2, 3, 4. All. Okay. And I have shown the different colors here. This title is important. See here. H1. Allergic formation. H1. First. Alphabet first. A number 1. Okay, matched. Both are matched. Allergic inflammation. Allergy. Inflammation means swelling. You will get two things. One is allergy, one is inflammation. Okay, H1 receptor is mainly responsible for that. Next, H2. Gastric acid secretion. Acidity produced by the H2 receptors. Keep in your mind, it is very, very important bit. Number of times it was appeared. H2. Acidity. H3. Neuronal transmission. That is neurodegeneration. It damages the neuron. H3. Damages the neuron. H4. Immunomodulation. It modulates the immune system itself. H4. Very dangerous for immune system. See how many 4 are there. One is allergic, Number 2 is a gastric problem. Number 3 is a neuronal problems. Number 4, immune system. This in between here matter is there that you want, you can read it. Alteration of vascular permeability, extensive edema, addition, not much required, but keep in your mind these are the very important H1 and the title, allergic inflammation, gastric. So here I gave the code of Agni. Agni means a fire. Agni, Sai Kumar dialogue is there. No, you can see the police story movie in that he will take Agni. His name is Agni. Okay, Agni means a fire. Okay. A, allergic inflammation. G, gastric acid secretion. N, neurological mission. Okay. And immunomodulation, I. A, G, N, I. And here you can see the 8 number. So far what we saw is 4, Agni, A, 4. And also 4 types of cells. 1, 2, 3, 4. Now you got a number 8. See here, 8 types of actions are shown resulted from histamine. Keep in your mind. Here, 1, 2, 3, 4, 5, 6, 7, 8. See, all these 4 are in red color. It's related to cardiovascular system. Cardiovascular system. See, dilation of blood vessels, how blood vessel is dilated. And H1, H2, H3 are responsible for this. 3 receptors. And frequent heartbeat. Heartbeat will be frequently it comes. H1 receptor, very important. H1 receptor, very important. And H1, H2, vessels, blood vessels and capillaries increase in permeability. Permeation will be increased. See how it is permeating? Easily permeable. Permeability, gap between one cell to another cell is increased. So permeation is increased. H1 and H2. Blood clotting. Activation of platelets, I have already. All these are related to blood only. Here, stimulation of H2 receptor, gastric acid, acidities, H1, allergy. Here you can see allergy, inflammation, swelling, and release of adrenaline. And here you can see asthma, allergies it produces. H1 is mainly responsible. Like that, you can remember all the H1, H2 and all. You can practice 8 the things are there here, totally. Yeah, now we will see 4 receptors one by one. Very important. First one is very, very important. Second one is very, very important. Okay, first 2 are very important. H1 receptor mainly for the allergy. See here how this fellow is doing with the allergy. Here you can see the hand, how allergy. We cannot tolerate that. Okay, we will get a itching. See cold. Cold is also caused from allergy only. Allergy is one of the type cause for the H1 receptor problems. H1, only H1. Mediator of allergy, flu, cold, inflammation. See here inflammation and allergy like this. All this comes from H1, H1, H1. First allergy A. Yeah, here you can see the classification of H1 antagonists only. It works against the H1. All these drugs we can use for the allergy. Antagonists, right? The 2 generations are there. These generations are appeared number of times in the question paper. N number of times it was appeared. First generation, second generation. In the exam, they will ask which type of medicine is first generation, which type of medicine is second generation, third generation, fourth generation. 2 generations are important. First generation, see how many is there? 1, 2, 3, 4, 5, 6, 7, 8, 9 are there. In first generation, this shows the marked potential for producing the sedation. It also produces the sedation. That is the biggest problem. All these drugs, it nullifies the allergy, it treats the allergy, but it produces the sedation. Very important, high sedation. Patient undergo into the sedation. See red marks, all these red marks, 1, 2, 3, 4, 5. These produces marked sedation. All are belongs to first generation only. Okay, and see here, used to treat the motion sickness, this green color, cyclizine, diphenhydramine, okay, dimenhydrinate, and hydroxyzine and meclizine. These are the used for the motion sickness, which is mainly due to the H1 receptor only. Second generation, all these are the second generation. 5 drugs are there. In that, weak potential for producing the sedation. Second generation also produces sedation, but less extent. That is very important bit. Less extent. And non-sedating, you can see here, non-sedating, they do not produce any sedation. This is also important bit. Which of the drugs works against the allergy but do not produces any sedation? Very important. Okay. Desloratadine. What is the speciality of desloratadine? In the exam they will ask pharmacology. Fexofenadine, loratadine. Okay, so this take a screenshot and different colors I allotted. Okay, and you have to practice. First we will see among the all, first important thing is here we will see only the important one. Chlor Phenaramine Maleate. This is very important drug, highly important. Here Citrizine. This is also important. These two drugs are very important and most common. CPM, Chlor Phenaramine Maleate. You can remember easily with the help of this CPM party. CPI, CPM. Two parties are there. Both are from only one party only. They divided into CPI, CPM. Marxist party. Okay. Drug, it comes on the class is H1 blocker. Pharmacological is anti-allergic. Mechanism of action, we know it blocks the H1 receptor. Same story, same story. Okay. And for the, it is used for the treatment of allergic rhinitis, urticaria, common cold, allergic asthma, hay fever, high fever. Okay, hay fever, and angioedema, swelling in the heart, angioedema. And CPM, chlorphenaramine maleate, is wonderful drug. It's popularly available as a Avil 25, Avil 50. You Google it, Avil 25, 50. Wonderful for histamine. It kills the histamine, which is secreted on the spot itself. It kills. See here, each uncoated tablet consists of 25 mg. Avil 25, not tablet weight. Avil is 25 in that tablet. Tablet weight varies. It differ. It more than 25. Okay, wherever they will mention 25, it is a 25 is Avil only. That is chlorphenaramine maleate only. Total tablet weight they will not mention on the tablet strip. Keep in your mind, right? Next important drug is citrizine. Citirizine also you can call it as citirizine tablets. See here, these tablets are also very popular, using for allergy. Excellent. Using for these symptoms including sneezing, running nose, itchy, runny nose will run somewhere, okay, and itchy nose or throat. 5 to 10 mg orally once a day. That's it. But this citrizine, it belongs to second generation. Here I have shown no citrizine. Citrizine, second generation. Okay, sedation it produces. First one, chlorphenaramine, it is also sedation. These two drugs produces the sedation. That is why it is the biggest problem. CPM, cetirizine, adverse effects, examination, very important. Sedation it produces, decreases the alertness. You are not in alert mode when you consume this tablet. Motor incoordination. There is no motor in the brain. We know motor part, okay, which gives the signal to the entire body. There is no coordination, so that he was unable to walk properly. No coordination from the brain. Tendency to fall in the sleep. He want to fall down on the floor or on the bed. Okay, fall on the sleep. And blurred vision. See here how we are looking. Focus. Blurred vision. Okay, these are the biggest problems of the CPM, citrizine. Very important. And the chlorphenaramine maleate, that is CPM tablet, 4 mg is available. Here you can see the caution. You have to print on the label. Compulsory you have to print. It is a rule is there. Whenever you are using antihistamine drugs, this you have to type. This may cause drowsiness. If affected, do not drive. Don't go for driving if you consume these tablets. Or operate machinery. See, don't operate missions. Don't drive. If you go for driving, drowsiness will be there, decrease alertness, you are falling in sleeping, something accident will occur. In the examination, number of times in competitive examination, they have already, this question was given, which drugs we should not give before driving, number of times. And you have to mention on the label itself, don't drive. H2 receptor. This H2, excess of the gastric acid secretion. See here how the gas is creating. This is mainly due to the histamine and H2 receptors which is produced, which are there in the stomach. Okay, acidity, stomach burn, and antagonist which works against the acidity. Ranitidine, very important drugs. Ranitidine, cimetidine. These two are very important than this. Burimamide, metiamide. It is also important, not much. Ranitidine, cimetidine. Ranitidine is available as a 75 mg tablet. Cimetidine is very oldest drug. It is also available in the 200 mg. Nowadays, all are using rabiprazole. Okay, that is a proton pump inhibitor. Rabiprazole, omeprazole. Okay, not comes under H2. And H3, nervous. Agni, in Agni 3 is N, neuron. So here, see the healthy brain and Alzheimer's brain. H3 receptor histamine is responsible. Your brain will be, as age is proceeding, your brain will become a less shrinkage of the brain. Parkinson's disease, it causes a Alzheimer's disease, it causes a Parkinson's disease. These are the two important diseases. There is no coordination, hands are tremors will come, shivering. This is also asymmetrical, one side heavy and on the other side less. These are some of the problems. And you want to take the drugs against this means sirpaxifan, pitolisant. See here the name pitolisant. Available in the form of tablets. It works against the H3. In the exam, they will ask, like, match the following: H1, H2, H3, H4, and they will give drugs: ranitidine, pitolistatin, CPM, like that they will ask you. Okay, globin profit, okay, conicin, and H4 receptor, immunomodulator, Agni, NI, lasts, immunomodulators, and which works against this H4 receptor is very important, and thiopyramide, keep in your mind, thiopyramide, use it to correct the immune system, or it works against the H4 receptor, right? Okay, we will see and we will end up the session here. Thank you and all.